Welcome to another edition of Lifelines with Mima. It promises to be an intriguing episode today. We're coming to you from the hospital, Medimax Hospital, our official partners. And today we'll be discussing infertility and how it affects us today. I'm going to be welcoming a few young couples that are going through this, and we're going to see how we can work with them and try and resolve the problem. Don't go anywhere. I'll be right back. Welcome back. With me, I have three young couples that are dealing with the issue of infertility. Of course, you know their story. We've met before. They came in with other issues that we have dealt with. But today, we're facing infertility and how it affects them. Of course, you know this topic is very sensitive to my heart because I have endured it for some time as well. And I know what it means for people to pass through this thing. And so today, I want to make sure that, you know, the home front is okay and medically they are also fine. Welcome, guys.
Thank you. Thank you.
Thank you for coming. How have we been?
Fine.
She did her nails.
Yeah.
And she has makeup on.
I changed my hair.
Oh.
It's a miracle.
I know. How are things to you guys?
Yeah, we're cool.
Yeah. I can see. Okay. How about you guys?
You don't have to conclude. Amina.
And she has even put on some weight. Oh, that's good.
You didn't tell her what I have. She has been trying.
Okay, that's good.
Say right now is I don't have any issues with my womb. My womb is okay.
Everything, even the hormonal test that we did, everything is normal. Your womb, the scan, the other tests, everything suggested that.
And my husband here is fine.
Fine. We even did the sperm parameters, which is the primary thing that we do for male, for the males. All the parameters are within normal range.
Doctor, sorry
Yes,
to
madam.
say, are you sure you checked him very well?
Of
And he's
course.
okay?
I don't understand.
Of course.
Why are you laying emphasis
No,
on
you don't have
checking
to.
me?
Everything is fine. We did it the way we should.
Back to the discussion, doctor.
Yes.
You have seen that everything is okay. So
Yeah.
what do you suggest we do?
Well, when a diagnosis of unexplained infertility is made,
Okay.
we must start looking at other options of conception. We may probably look at assisted conception, the one that people call IVF.
IBS.
Yeah,
When
yeah.
IBS, kuma.
IVF.
Oh, IBS.
Yes, IVF
Okay.
is an acronym for in vitro fertilization.
Sorry?
In vitro fertilization, or test tube baby.
Okay.
Yeah, because what usually happens is this: when there are concerns with
Doctor, I
conception.
don't want a bastardization.
No, it's not about that. No, it's not allergy. It's not. You know, this thing has been around. It's just that people are beginning to also know about it. You know,
Okay.
in vitro fertilization is still your seed and her eggs you are going to use. It's just that now we are going to take control of the process with the knowledge that God has given us to making sure that we get what we want.
Okay, one day, okay, kira artificial baby, kira.
No. It's not artificial. It's still your baby. What happens is once the conception starts, it's like any other pregnancy.
So does that mean that I would carry a child in my womb?
Of course, because every parameter suggests that there shouldn't be any reason for you not to. Okay. So it's the IVF you are going to do now to ensure that that happens. And besides, you are young.
With what you have explained, I'm already seeing her stomach protruding.
The chances of you having more than one is even increased when you do assisted conception.
Exactly.
So we should be hopeful that God will just give us what we want. This is what we do here. And we have been having a lot of successes. We have had a lot of satisfied clients over the years. So your own will not be different.
That is why you are called a doctor.
Yours
You
will
have
not
one
be different.
solution to my problem.
Yes, I agree
Thank
so
you
much.
very much, doctor.
Thank you.
Thank you
Elijah.
very much.
Thank
Thank
you.
you.
Sometimes I think about 3 years ago,
Mm-hmm.
we went to see a doctor. We've been married for 7 years now.
Okay.
Yes. So we went to see a doctor, and it happens to be a traces of fibroid.
Okay.
Yes.
Okay.
And also have heavy flow, and it used to be very painful.
Oh.
As in very painful.
Oh.
Yeah.
So when the flow comes, does it come in clots?
Yes, sir.
It does?
Yes, sir.
So you change the sanitary towels quite often?
I use more than 3 sanitary pads.
Oh.
Yeah.
So I guess that after the period you feel quite weak because you lost quite a lot.
Very well, sir. And we've tried to take local herbs.
Oh.
Yeah.
Well, local herbs, they are not part of the treatment. Most of the time you take it for months and yet you don't get much relief.
Yes.
And over 7 years, you can expect that the fibroid will have grown bigger. Then the symptoms will even get worse. The truth is that fibroids can also contribute to a couple not achieving pregnancy. It can. It can, really. But what happens is depending on the location in the womb, it can block the fallopian tubes. It can also, occupy so much space within the lining of the womb so that implantation becomes a problem. Implantation becomes a problem.
So, doctor, please, what can we do about this?
Well,
What do we do?
Is a fibroid. It's a growth, and such growths are not supposed to be there. So they have to be removed ultimately. They have to be removed by way of surgery, of course. There's no amount of medication you are going to take that will take it out entirely.
Doctor, hope it's not that risky.
No, it's not, especially when it's done in good hands.
Okay.
You can be rest assured that the outcome with God on our side should be favorable.
Okay.
Should be favorable.
So, like, how soon can one do this?
Well, we have seen now, we have evaluated you. We can plan and book you for our next theater day. We are going to run further investigations, then get you ready. You will come to the hospital on the eve of the surgery day, then with the other members of my team who will do the surgery.
Oh, okay. Thank you so much, doctor.
Within an hour,
Okay.
an hour plus, at most 2 hours, we should be
And,
through. There's nothing to be worried about.
Sorry, doctor, after the surgery,
Yes.
she'll be able to conceive, right?
Yes, because what happens is this, when the surgery is now done and the fibroid is out of the way, we'll just allow her to rest for like 2 months.
Okay.
Then we'll now
And I can
try.
start.
Yes, we'll now try.
Thank you.
Yeah.
Thank you so
Thank
much.
you so much.
Yeah.
Thank you so much,
Thank you so
doctor.
much.
Well, I will not tell you to stop your work. Your work is important.
Yeah, it is very
At the same time, if it's a kind of job that may warrant your wife to also meet you up when she's not safe, then I would suggest that once in a while that should also happen.
But we, oh come on, we meet anytime I come.
Anytime what? You meet anytime you come. Once in a month.
No, that's not good enough. Once a month is not good enough. You will try. When she's not safe and you're at work, she can just come and pay a visit for that period.
Okay.
If we really need to do that. Except you may not want her to come around. I don't know what you think about that.
Well, at least you tell me now. You should tell me that this is at least. Yeah.
We should
because I will not come
agree.
and check.
We need to agree on this. That's why we are here. So let's agree together before the doctor.
Yes, while we are doing that, we should also run some tests, just to know where
Some
this
tests.
problem may be coming from. Yes, because sometimes tests may reveal 1 or 2 things that may need to be addressed as well. Yes.
Okay. So, when do you think? I mean, you should say because Time, I don't, let me not say time, because I'm not always around.
Yes,
I
I
come in
understand.
2 weeks, I'm out.
Mm.
You understand?
Yes.
So you should say
So now that you're around, we can do it now. We can start now.
now.
Yes. Or before you go back to work.
Yes, before you go back to work. For how long have you been in town now?
I'll be going back very soon.
Okay, how soon? We want to know whether it's something we can do before you go back.
Maybe I could make some and weekend or something.
Okay,
Yeah,
okay.
good.
So, before you go back, you come in so that we can run some of your tests. Would that be okay?
It's fine by me.
Okay. At least we'll run your tests. She is here, so we can always do hers. So that by the next time you will come in, we can review the test results.
Okay. Okay. No problem.
Welcome back. With me now, I have Malam Machido and his wife.
Right.
They just saw the doctor. Let's have a quick chat with them. Welcome.
Thank
How
you.
did it go?
Well, it went well. Everything went well.
Okay. What did the doctor say was the problem?
Well, there is no problem.
Really?
My wife is okay and I am okay.
I see.
And he even said we are going to have a baby
Oh.
through PTF.
No,
PTF.
sorry. IVF.
Oh, IVF.
She didn't.
Oh,
Yes,
wow. Okay.
IVF.
Oh, okay. Okay.
Yes.
So there is no cause for the delay.
Right,
It's
no
unexplained.
problem. Well, yeah, the doctor said it as a result of Mayachema. We unforeseen. Anyway, we have no problem.
Unexplained.
My wife's womb is okay and Mima Bata very well.
Oh, that's good.
Eh,
That's good. You guys look good.
Thank you, Mima.
How are things going?
Fantastic.
From the last time, has there been any improvement?
Yes.
So it's no longer once a week. It's how often now?
Well, I'm so happy, you know.
Oh, wow. That's
Yeah,
good.
I think she has increased to at least 3 times in a week.
Oh, that's a lot.
Yeah.
Oh, that's good.
I'm still lobbying for more time, you know. So,
All right. Oh, that's sweet.
yeah.
Okay. And how about you? How are things?
Yeah, good.
Okay.
Yeah.
Are we talking more now?
Yes.
Okay.
Yeah. There's a lot of
And-
improvement.
Oh, okay. That's
I
great.
am of good behavior. She can attest to that,
Great.
right?
That's what I
Yeah.
want to hear. Okay. That's good. Okay. So you saw the doctor. What did he identify any problem? Did he give us any advice?
Actually, he mentioned fibroid.
Oh, okay. She has
And,
fibroids.
Yes, and he suggested that we have surgery.
Myomectomy.
Yeah.
Okay.
So that's it.
Oh, okay. Well, it's one of the causes of infertility. Happens to us a lot. It's mostly African women and I think down South America as well.
Okay.
But he is well experienced, one of the best actually in Abuja in terms of that.
We're
So
told.
I know that the surgery is going to be a breeze for him. As soon as that is out of the way, you can...
And I'm so happy. He said after the surgery, she's going to conceive and I'll have my own child.
Oh,
Yeah,
I
it
will
can't
happen.
wait.
It will
Like,
come.
seriously. It's been 7 years of marriage and we've been through this.
I know.
Yeah.
How are the in-laws doing?
It's not been easy, but
It's
my
not
wife,
been easy
she's...
at all. Yeah, from his own side,
Yeah.
actually. But for me, I know soon God is going to answer our prayer.
He will.
Yeah.
Continue to love them. That's all to do. Just continue to love them. When people make life difficult for you, and you continue to love them no matter what, they'll get tired eventually.
I'm doing that.
Yeah.
I'm trying my best.
That's
She's
great.
trying.
That's good to know.
And my mom is getting to like her.
Oh,
Yeah.
that's good. That's good.
Yeah.
At the end of the day, like I always advise, the most important thing now is to take everything to God.
Yeah.
You are in excellent hands. The doctors here are very good. But they're human, so we do what we can medically, but the rest we leave to God.
Yeah.
Another very important thing is your closeness to each other. This is when you need each other the most. Surgery, treatment, everything, it's usually not so easy. But if you have each other, it makes things better. As much as possible, keep it to yourselves. Most people don't don't see it as a good thing, or they are not kind with their words when they talk about you when you're going through infertility. When they're with you, they might sympathize, but you know, behind you, they usually have very bad things to say.
Sure.
And so I think that it's a personal journey for you guys. When our babies come, everybody else can come and celebrate.
Sure.
And I know that by God's grace, they'll come. How are we doing?
We're good.
You look lovely.
Yeah.
Thank
Look
you,
at your
Mima.
nails.
That's what he is admiring. He's been admiring it like forever.
Oh.
Man, this is what I've always wanted.
And you didn't tell me.
No. You know, I've been saying all this. I mean, I really want to thank you for all of this. If not for you, I don't
Things
know.
are better.
Really good.
And you know, you've not missed one day of your classes, so I know, you know, that you've really been committed to this, and I'm really proud of you
You've
guys.
really been of help to
He's
us.
trying.
Really.
Ah. Okay. So how did it go with the doctor?
It went very well. I mean, the doctor told us what we should do.
Okay.
I mean, I found out that it was kind of my fault, actually, because I'm always in town.
Okay.
Always out and coming in and out. And I mean, it's high time I actually readjust my timing.
schedule, okay.
I mean, I really want this to work. I need to, you know, cut down some things to make this really work. I'll do anything just to make sure I have my baby back.
He will do anything. You're my witness. He'll do anything. And you have me back anyways.
Okay, so the doctors think we should spend more time together. Yeah, it's important.
He said we should come for a test.
Okay.
So he will take our samples
That's
when we are
right.
ready.
Okay.
But soon.
Okay, that would be good. Yes, it's important because you see, with a woman's cycle, you have to meet with her at a particular time. And if you keep missing that, it's usually very dicey. And you know, of course, our reproductive system as human beings, it's very weak. For a couple that everything is perfect, your chances of conceiving every month is not more than 20 to 25%. And this is when you're even having regular sexual intercourse. You know, now talk less of when you're too busy to actually be together all the time. So yeah, I think that once we begin to spend more time together, give it a go, after going through all the tests, I think that we're gonna come out happy, have beautiful babies.
Yeah, very beautiful.
We are looking up to that, hopefully.
Okay. Welcome back. We're still treating infertility and how it affects us today. I'm really happy that things are moving well today. With me now, I have our doctor, the consultant, and I have Tutu and Titi, you know, the Tutu, Titi.
Yeah.
And we just want to have a quick chat with the doctor. Thank you, sir. Thank you for everything. You have been very patient with us.
Welcome.
You know, you have very thorough.
And the nice hospital you have here.
Oh,
Yeah.
that is mine. Thank you
And
so
your
much.
scrubs, very nice.
Oh.
We're so used to seeing him, yes, in a suit and a tie.
Yeah,
And
you know, this is my natural
habitat.
this is my territory, so
Okay.
I feel more comfortable in this.
Wow.
You have a couple that you have checked, you have examined them, you've realized that the man is fine, you've realized that the woman is fine, but they don't have kids.
Because all the tests have been done, that's all the tests that are available in our environment to be done to rule out any problems. They've all been done and they look apparently normal. And there's no pregnancy. What do? Of course, you have to look for a way out. You can't just tell them to go home and be trying. There has to be a way.
Like,
Thankfully, there are options.
okay.
There are options. And like assisted conception.
IUI or IVF?
It depends. If you've been trying for longer periods, you may decide not to just do IUI, which is intrauterine insemination. Because the truth is this, why has she not gotten pregnant?
Yeah, despite the fact that everything is supposed to be okay.
Fine. It means there's still something happening that the tests are not really showing. So,
can you explain that IUI properly?
well, IUI is intrauterine insemination. What happens with IUI is this. We assume that the fallopian tubes of the woman is okay. Then the sperm parameters are also okay, but there's no pregnancy. In some cases, the sperm parameters may be a little low. Yeah, so you may also want to do IUI for such couples. So when they come in, we see them, we put the woman on certain medications. Sometimes a combination of tablets and injections, sometimes only tablets, sometimes only injections. Over days, we try to mimic the menstrual cycle. Then we target the time that she should be ovulating. That's when we do the insemination. But of course, we're going to monitor with scans intermittently, you know, maybe alternate days to see the progress, the response in terms of based on the medication that she's taking. At a particular time when we feel that, yes, these eggs are ripe, we might now initiate the process of the insemination. We get the man's sperm out, then we try to prepare it, process it, remove all the debris, then concentrate it. Then we now use a special catheter and deposit it. The theory is this: when you deposit it there, it has bypassed the long journey it should have taken, all the swimming and the way to get to it. So it will just remain there.
You took it
there. On that hour and that day, we expect the eggs to also meet sperm there. So
you just release the sperm around the eggs, not like you break through to the egg.
No, just IUI. So that the swimming is just like someone trekking from here to maybe like 1 kilometer. That's if you want to compare it, how far sperms you have to go to meet up. So now you have bypassed that, you have carried them and kept them at the meeting point.
Right. So you've saved them the journey, the trouble of.
So with that, we now expect nature to take its course. Then whatever now happens, we see at the end of the cycle.
At what point do you advise a couple to go for a surrogate mother of a child?
Well, indication for surrogacy, if the woman is not able to carry.
She's not healthy enough.
She's not healthy enough to carry the pregnancy, or maybe there are problems with the womb. Those are the two major for medical reasons, you understand. But what we have in our practice, most of the time they are quite older. Maybe they have some medical conditions, hypertension, diabetes. For that, you may not want her to go through the rigors of pregnancy, because when you do that, you cannot determine, you cannot know what will happen to her too with all the because pregnancy as well. It may not be a disease, but it takes a lot.
It takes its toll
on the woman. So we may advise that at that point, surrogacy seems to be the only way before you probably consider like adoption.
A friend of mine told me about a friend who menstruates just once a year. And I think they said it's because of her weight, that she has so much weight. And the doctor have told her to reduce weight, so that her menstrual cycle gets normal. But I just want to ask, in case she can't lose weight, what are her chances of getting pregnant?
I want to use this opportunity to dispel this myth about menstruation and ability to get pregnant. There are two different scenarios. In fact, menstruation and ovulation are two parallel events in the menstrual life of a woman. So someone can menstruate very well and not be fertile. Because fertility is about the eggs, not the menstrual blood that sheds at the end of the month. So then at the same time, you may not be menstruating very well. I must say that once a year is extreme. I must say. Some people menstruate 5-6 times a year, and they don't really have problems with getting pregnant too. You understand? But when it's once a year, I think it calls for concern. Apart from the weight, there may be some other issues that needs to be investigated, because if it's about weight, she can lose weight. We're not saying that you should lose all your weight. A minimum of 10 to 15% of your total weight is enough. for the menses to come. But that doesn't now mean that when you start seeing your period that you are going to start getting pregnant. So we use the opportunity to tell people that menstruation and ovulation are two different things.
Wow.
They are two different things.
Thank you so much.
Yeah.
Welcome back. Wow, it's been a good day for me. I'm really happy. You know, it's what I live for. I mean, when you work with people and then you see that your work is making a difference, you know, it just is my own paycheck, and I'm feeling very happy and elated today. For all of us out there going through marital challenges, please know that you can seek professional help. It doesn't have to be spiritual all the time. You can seek help professionally and make way, you know, for things to grow and improve. There's nobody that goes into a marriage, you know, with the expectation of walking out of it just like that. I know it gets difficult because we don't go to any school of marriage. We just find ourselves in it and we begin to struggle with the problems that come with it. This is why we are here. I want to encourage each and every one of you out there. You can reach me on social media, write me an email at any time, and we'll definitely make time to respond and get to you. From all of us here, and until we see you again, don't forget that you do not need to go through life's challenges alone. Why? Mima cares.